Ensuring safe surgery is an important patient safety goal. So why is it important? Because when we look at data, wrong site surgery is one of the commonest sentinel events in a hospital. And according to some data, it is the second most commonest sentinel event. So there are three procedures which will ensure a safe surgery. So these are surgical site marking, a surgical safety checklist, and a timeout. So it's not imperative that it's only surgeries need to follow the safe surgery protocol, but all invasive procedures in a hospital need to follow this. So when we come to surgical site marking, the important points with regards to surgical site marking are that it has to be done by the surgical team along with involvement of the patient. It has to be something which can be easily recognized, and a standardized format is followed throughout the hospital. And it ideally to be done the day prior to the surgery. The next procedure is following the surgical safety checklist. So the most commonly followed surgical safety checklist is the WHO safety checklist, which has three components. So there is a sign-in, there is a timeout, and there is a sign-out. So this ensures that all the documents and the equipment that is required for the procedure is available, they are correct, and they are in working condition. And it also ensures that the correct site, the correct patient, and the correct procedure is followed during the surgery. The third component of when we look at safe surgery is the timeout. Now, timeout is a often very neglected part of the safe surgery procedure. And in this, so how to go about the correct way to do a timeout is, so before the skin incision is made, the whole team stops doing anything what they're doing, they stop. The surgical team, the nursing team, and the anesthetist team, all of them, they talk to each other. So there is a floor nurse who reads out the checklist of the timeout. All the members, they introduce themselves and their roles, and everything is ensured that everything is placed to ensure a safe surgery. So if these three procedures are diligently followed, it will help us a long way in ensuring that wrong site, wrong procedure, and wrong patient surgical procedures are avoided. And hospitals, it's their responsibility to make sure there are policies in place to facilitate the healthcare workers in implementing this.